Hello Periscopers, Dr. Olivia Joseph here. I wasn't planning on talking to you about heart disease today, but I figured I might as well capitalize with it being Valentine's Day weekend and matters of the heart, and the American Heart Association putting out a lot of press on wearing red shirts and speaking about heart disease. So I thought this was a great time to educate you on some natural things that lower your cardiovascular risk factors, but also to educate you on some real risk factors for cardiovascular disease that you might not even be aware of. So first, let me talk to you about some things that increase your risk for heart disease. And you might be thinking the most obvious thing like high blood pressure, high cholesterol, and diabetes. Now, those things are true. So if you find out you have these things, what are you going to do? Well, if you're like most Americans, you're going to start medication for these things, right? Because you find out you have a disease or you get a diagnosis. And so how are you going to fix that? With medication. And what ends up happening is you get false hope because that medicine that you take for your blood pressure lowers your blood pressure. The medicine you take for cholesterol lowers cholesterol. The medicine you take for your blood sugar may lower your blood sugar. But all the while, you don't change your diet, you don't change your lifestyle, you don't change the supplements you take, and your risk factors really don't change. So just to give you a little bit of fact, half the people who have a heart attack and a stroke in the United States have normal cholesterol. I just had a patient last week, a lovely lady who came in. And as I was doing her history, I always go through a list of medications that they're taking and what they're taking those medications for. And she told me she had a heart attack last year. And I said, I'm so sorry to hear that. Is that why you were put on these medications? And she said to me, no, I was taking these medications when I had my heart attack. I said, so hold on, let me just make sure I have this straight. You were taking blood pressure medicine, you were taking cholesterol lowering medicine, you're not overweight, and you still had a heart attack? She said, yeah, I find that interesting. So I think what happens in America is we medicate for this, and then this, and then this. I see more people with high blood pressure, high cholesterol, and diabetes than any one of those things alone. So one thing you need to be aware of is if you have a high level of inflammation, that puts you at a higher risk for cardiovascular disease. And those medicines that I just mentioned for diabetes, high blood pressure, and high cholesterol, they don't reduce inflammation at all. Having high levels of inflammation raises something called C-reactive protein. Now, you can have C-reactive protein tested on any old blood test. It's not fancy, it's not special, but it gives you a better picture of your cardiovascular risk than cholesterol does. So if you have normal cholesterol, normal blood pressure, and you get a C-reactive protein test back and it comes back elevated, you are at a higher risk for a heart attack. Okay? You have to be aware of those markers. And every cardiologist I know and every cardiologist I work with is testing that as a marker. Now, not every family practice physician is. They're usually just testing blood pressure and cholesterol. And the problem is you could be a ticking time bomb and not know it. Another thing that I see quite a bit is elevated homocysteine. Homocysteine is an inflammatory marker which increases your risk for a stroke. So hopefully you're getting the gist that inflammation increases your risk for heart disease, heart attack, and stroke. Now, what do you do for homocysteine? Well, what typically causes people to have elevated homocysteine is a gene mutation called MTHFR. And if you find out you have this gene mutation, you need to avoid supplements that have folic acid, and you need to only take supplements that contain the methyl form of folate, which is L5-methyl tetrahydrofolate. I know it's a mouthful, but it's very important information for you to know if you have this gene mutation. And just so you're aware, 60% of the population has this gene mutation. So there's a pretty good chance you may have it, and it does increase your risk of stroke. So if you do have an elevated C-reactive protein, what do you want to do? Well, you want to do whatever you can to lower that C-reactive protein. So what I use with my patients, fish oil, ginger, turmeric, and boswellia. I'll also use garlic, but you have to be careful because some people do have garlic sensitivities or food allergies to garlic. I food allergy test a lot of my patients, so usually I have that information to decide on what I'm going to use with them. But I will say fish oil, ginger, turmeric, and boswellia. Studies are being done right now on boswellia and its benefit for heart disease. Now, it's still in the early stages. Turmeric is used for inflammation all over the world. You can eat it and you can take supplements that contain therapeutic levels. But another thing I do want to make mention of is ginger in that family. So let me tell you how I came across ginger. When I started practicing 13 years ago as a chiropractor, a lot of people came to me because they had pain, right? Back pain or what have you. But the interesting thing is 13 years ago when I started practicing, Vioxx was hot. It was prescribed for arthritis pain left and right. But a lot of people were dying of heart disease from taking this medication. So Vioxx got recalled by the FDA because so many people were dying of heart disease. And during that time, I had so many patients coming to me saying, I have, my pain is so bad, my inflammation is so high because I had to stop taking Vioxx. What else can I do? There's no pain reliever out there really helping me. So I started doing some research on, gosh, what can I recommend for my patients to really help give them pain relief in addition to things they were doing like chiropractic, acupuncture, massage, glucosamine, MSM. I mean, those things are really popular, but people needed more than just those things. So I found a lot of research on ginger. And ginger became very popular originally when Vioxx got recalled. Turmeric 13 years ago was not as popular as it is today. And what you need to know is that ginger and turmeric are in the same family. They're both a root and they both help tremendously with inflammation. But the great thing about them is they're great for your heart, great for your stomach, won't cause any damage to your digestive tract, your liver, or your kidneys, which a lot of pain medication will. I mean, non-steroidal anti-inflammatory drugs are great pain relievers as needed. But if you need them daily for weeks or months at a time, you're playing with fire because you could really damage your stomach, your liver, your kidneys, and also they may have a negative impact on your heart. The FDA has just issued warnings in 2015 against non-steroidal anti-inflammatory drugs and in the fact that they can cause a heart attack. Well, that's what Vioxx was, a non-steroidal anti-inflammatory drug. Celebrex also got recalled for the very same reason. So what I want you to know is that just because you have normal cholesterol, normal blood pressure, that does not mean you are at a low risk for heart disease. Even if you're taking medication. You want to take your health into your own hands and you want to ask for the right testing. Ask for a C-reactive protein if you're at a high risk for cardiovascular disease. Ask for a homocysteine if you have a family history of stroke. And if that test does come back positive, ask for an MTHFR gene mutation test. This is testing that you have at your fingertips. Any doctor can order them. If you have any questions, see a cardiologist. I would encourage you to find a cardiologist if you have heart disease that is trained by the Institute of Functional Medicine. And what you're going to find is many of these tips I shared with you today, like garlic, ginger, boswellia, turmeric, fish oil. This doctor is going to talk to you about those very things, as well as things in your diet that are very inflammatory, like gluten. I hate to say it, but it's true. Not just a low-fat diet, really avoiding foods that are inflammatory, which of course are deep-fried foods and a lot of your dairy products, to be perfectly honest with you. So I hope that these tips help keep your heart healthy. And keep an eye out because I'm going to be doing longer periscopes more specifically on some of the ingredients that we talked about today, particularly ginger. I don't think ginger gets enough attention now that turmeric's the big man on campus. So I'm going to be doing a whole periscope just on the benefits of ginger, reasons to take it, some negative press that has no research to back it up against ginger. So that's going to be one of our hot topics we talk about on one of our next periscopes. So happy Valentine's Day to all of you, and I hope your heart stays super healthy.